Do you feel leg pain or numbness when you walk but goes away when you sit down? It may not be in old age, but it could be spinal stenosis, a silent spinal problem that is more common than you think. Meet Mr. Sandeep, a 51-year-old IT professional from Bangalore. For years, he was spending long hours at his desk and ignoring occasional back pain until one day, even walking 20 steps became a challenge. It started slowly, a back pain after walks and heaviness in both the legs, tingling that comes and went. But over a period of 5 years, pain grew and his legs would hurt even after walking few minutes, and standing brought the numbness and sitting could relieve the pain. This is called neurogenic claudication, a classical sign of condition called lumbar canal stenosis. Sandeep tried all kinds of treatment: Ayurvedic massages, traction, neuropathic medicine, painkillers, and sometimes it could relieve the pain, but deep inside the real problem was getting worse. When he visited us, the scan revealed the truth. The gold standard for diagnosing any spinal problem is MRI scan. It showed severe lumbar canal stenosis at L4, L5 region with slip vertebra, and which was compressing the nerve roots and holding the nerve roots very tightly, and joints in between the vertebra also was becoming big and pressing the nerve roots. After seeing him and after evaluating clinically and correlating with the MRI, X-rays and CT scan, we advised surgery, that is T-lift surgery, TLIF, a transforaminal lumbar interbody fusion surgery. In this surgery, we'll remove the pressure on the nerves and free the nerve roots and fix the spine with plates and screws and titanium cage. Sandeep underwent the surgery, he tolerated the procedure, there were no complications, and next day he was back on his feet and there was no leg pain and no more rest to relieve his pain, and he was confident to walk and pain was relieved. He was discharged after 2 days of the surgery and back to his work and pain free, and is living without any fear and without any pain. Spinal stenosis can steal your freedom, but timely diagnosis and expert care is important. If you or your loved one are struggling with back pain, weakness in the legs, or on walking, pain and numbness getting aggravated, and on taking rest, if it is getting relieved, it can be neurogenic claudication and it can be severe spinal canal stenosis. Please get evaluated. I am Dr. Ganesh Veerabhadraya. I am a consultant neurosurgeon, brain and spine in Kaveri Hospital, Electronic City, Bengaluru. Let us know briefly about spinal stenosis, what it does. Spinal stenosis is a narrowing of spaces in your spine which can press on the spinal cord and nerves, and most commonly in the low back area, especially in adults over 50 years. Let us bust few myths, around 10 myths I have made. Myth 1: spinal stenosis affects only elderly. No, it can happen only, it can happen even younger age group with a disc herniation or injury, or sometimes congenital narrowing of the spinal canal stenosis, it can happen. Myth 2: the back pain means you have a spinal canal stenosis. Truth is, not all back pains are due to stenosis, or accurate diagnosis requires clinical examination and MRI scan. Myth 3: spinal stenosis always gets worse over a time. Truth is, with proper treatment early, many patients maintain a good quality of life and avoid progression. Myth 4: surgery is the only treatment option. Truth is, physiotherapy, medications, posture correction, and lifestyle changes, many avoid surgery. Myth 5. Bed rest is the best solution. Truth. The staying active with modifications is better, and prolonged rest can worsen the stiffness and muscle loss. Myth 6. Spinal stenosis can cause paralysis. The truth is, the paralysis is extremely rare. Many patients have symptoms like pain, numbness, weakness, and manageable with the treatment. Myth 5. If you have a stenosis, you should avoid exercise. Truth is, target exercises under supervision can reduce symptoms and improve the spinal support. Myth 8. Pain medications are harmful and addictive. Truth is, when used correctly for short time, they'll provide the pain relief and improve the function, and later physiotherapy and exercise can be advised. Myth 9. Everyone with spinal stenosis eventually needs surgery. Truth is, only small percentage with severe worsening of the symptoms require surgery. Myth 10. Spinal surgery for stenosis is extremely risky. Truth is, with moderate techniques, spinal surgeries are today safe, effective, and also minimally invasive surgery can be performed. And I have made some facts about key facts about understanding spinal canal stenosis. The 10 facts about spinal canal stenosis are: one, spinal stenosis is a narrowing of the spinal canal. It narrows and put the pressure on the spinal cord, nerves, and cause numbness and weakness. Two, the commonly affects low back, and also can happen in the neck. And spinal canal stenosis affects walking, and in the neck it causes imbalance and tingling and numbness in the hands. And third, most commonly caused by age-related degeneration, wear and tear, arthritis, degeneration, thickened ligaments can lead to stenosis. Fourth, not everyone with stenosis has symptoms. Some people may have symptoms, but gold standard is diagnosed by MRI scan. Sixth, can lead to it can lead to neurogenic claudication. Yes, and classic symptoms like leg pain, heaviness in the legs, walking for distance, reduced numbness, and relieved by rest, and also known as shopping cart sign will tell. After when you go for shopping cart in the mall, you will start the pain will start appearing in the legs, and numbness it will happen. And once you lean down on the shopping cart, the pain will be relieved. Again, you can walk, and after some time, again you will get the pain. Again, you have to lean down. This is classically called shopping cart sign. It happens in neurogenic claudication or spinal canal stenosis. And seventh, yes, MRI is the gold standard for the diagnosis of the spinal canal stenosis. It shows the nerve compression, disc bulges, and ligaments thickening very clearly. 8. Non-surgical treatment may help many patients. Yes, and physiotherapy, medications, epidural injections, postural corrections are effective. 9. Minimally invasive surgery is available. Yes, and spine surgeries, when it is needed, modern techniques can reduce the recovery time and complications. 10. And it's manageable with the right care. Yes, early diagnosis and regular follow-up, lifestyle adjustments can maintain a good quality of life. And with this, we have come to the end, and we discussed about we discussed about the patient and how he presented to us, and how we diagnosed, how he improved, and some myths are busted, and we discussed about the 10 facts about spinal canal stenosis. And still, if you have more doubts, you can always write to us and contact us. If you like the video, share with people who are loved one, who needy. And thank you for watching. Have a nice day.